Hello, everyone, and welcome to the Illinois Policy Unpacked podcast, where we inform the policy conversation in Illinois and beyond. On this episode, we welcome Julian Rief, an IGPA affiliate and professor of data analytics and finance at the Gies College of Business at Illinois. His research explores the value and determinants of health, including the effects of air pollution, Medicare Part D, and medical innovation. His work has earned national recognition and has been supported by major institutions such as the NIH and NSF. Reif is known for connecting financial insights with real-world challenges. In his latest IGPA Policy Spotlight, he explores the latest Illinois air pollution trends. Today, we'll discuss what's driving Illinois pollution patterns, the health and economic risks they pose, and which public policies can help improve the air we breathe. Welcome to the podcast, Julian.
Great to be here.
Awesome. So for our first question, how long have you been an affiliate with IGPA, and what is your favorite part of IGPA?
Well, let's see. I have been an affiliate of IGPA since 2012, when I first came to the University of Illinois. My other affiliation is with the Gies College of Business, where I teach my classes and do my research. My favorite part, I think, of IGPA is that it's an institution for encouraging public engagement. So that is, it's a way for faculty to communicate academic insights to the general public, and that's not something that's normally rewarded by academic departments. You don't get tenure for communicating, economics and finance in an accessible manner to the public. And that's a shame, because a lot of the work that professors do, especially in economics, has important policy implications. And if we don't communicate that to voters, to the public, to government officials, then it becomes that much more difficult to translate important academic ideas into actionable insights. And so I think, the IGPA plays a very important role there, sort of at this nexus of academia and policymaking.
Great. Thank you for detailing your background with IGPA. You teach data analytics and finance at the Gies College of Business at Illinois. Your latest policy spotlight focuses on air pollution trends in Illinois. What sparked your interest in this topic, and why is it important for a finance professor to focus research on the environment?
Well, I'm an economist by training, and there's many different definitions of economics. My favorite definition is the one given by Gary Becker, a former professor of mine, which is that economics is a set of statistical methods and theoretical models for studying important topics. So if it's something that's important to people, and if economics has something to say about it that's useful, then it's an appropriate topic for economics research. So in the case of air pollution, the challenge with this topic is that it's actually quite difficult to estimate the true effect of air pollution on health. There's a few different reasons for why that is. One is that air pollution is often accompanied by other factors that matter for health, such as income. So, for example, we know that many of the most polluted places in the United States and around the world also tend to be lower income areas. And income also has effects on your health. So disentangling those two things can actually be quite tricky. Another challenge is that humans respond to things, including air pollution. When air pollution levels are very high, oftentimes people don't want to go outside. If you don't account for that, then you're going to misestimate the effect of air pollution on health. And so these are the kinds of things that economists have thought long and hard about for a long time. We're trained to deal with these issues, and that's why I think we have something of value to add to this topic.
Yeah, absolutely. As you mentioned, economics touches so many things, and health is just another piece of it
Yes,
for
that's right.
Illinois residents. In your publication with IGPA, you highlighted a drop in Chicago area air pollution from 2000 to 2020, while other metro areas in Illinois remain stable. What contributes to these trends?
So it's probably a combination of factors. So in the case of Chicago, in the last 20 years, we have seen the closure of one or two coal power plants, as well as I think also a couple have switched to natural gas, which produces fewer emissions. Also in Chicago, the air pollution levels there are greatly affected by the large number of trucks and automobiles. And as older vehicles are replaced by newer ones, that generally reduces air pollution levels because newer vehicles tend to be cleaner. This is especially true when it comes to electric vehicles, which don't produce any emissions at all. So I think that's probably the main thing driving the decrease.
It's kind of hard to disentangle, economics and income and so many other factors. How do you untangle that data to make sure that there are certain things like air pollution that are specifically causing changes?
Yeah, so this is a big challenge, and people have attacked it from a few different angles. So I'll talk about the main method I've used in my own research. In my own research, what we've done is make use of the observation that the level of air pollution on any given day depends greatly on which way the wind is blowing. So, for example, if you live in California and the wind is blowing in from the west, air pollution levels tend to be quite low because that's where the ocean lies, right? So it's blowing in clean ocean air. By contrast, when the wind blows in from the east or southeast, depending where in California you are, air pollution levels tend to be larger. And so more generally, all around the country, right, depending on which way the wind is blowing on a particular day, you might have high air pollution levels or low air pollution levels. And so in my own research, we've made use of this as sort of a natural experiment. You take a place in the country, and you compare, say, 2 Mondays in the same month, but on one day the wind is blowing from the west, and on the other day is blowing from the east. And so the hope is that everything else is similar on those 2 days, except for which way the wind is blowing, and as a result, what the levels of air pollution are. And so if we find, for example, an increase in mortality on the day where the wind is blowing from an area which is bringing in dirty air, then we can conclude that the change in mortality on that day is coming from air pollution. So that's one example of a method where we try to disentangle air pollution levels from other potential factors.
That's great. How did you come up with that to look at wind patterns?
So this is actually something that's been well known among atmospheric scientists for a long time. They actually build these very complicated models of atmospheric transport, trying to model how air pollution is carried from somewhere in Oregon all the way down to Texas or elsewhere. But it hadn't really been connected with health outcomes, at least not in sort of a very transparent setup that also, incorporated data from many, many years. And so really we were sort of bringing together insights from atmospheric science with a bunch of health data. In the case of this paper, it was information on death records over the course of about 20 years, and then also combining that with other data on weather. So really this was a large data gathering project that brought together insights from atmospheric science and then coupled that with sort of this economics toolkit that we've developed over decades for how to tease out causal effects when something is associated with lots of other things like income levels, as you mentioned.
Yeah, it sounds like economists have to be very in tune with a lot of different things to have an idea of how, certain outcomes might be met, like higher air pollution and mortality. So that's interesting how you tied in atmospheric science into it. How does high levels of air pollution affect human health?
Well, this is a question that's been studied by many disciplines. Clinicians have looked at it, epidemiologists, as well as economists, like we were just talking about. They all reach the same conclusion. You won't be surprised to hear, right? Air pollution is bad for you. There's lots of different types of evidence we have on this. On the clinical side of things, there are randomized controlled trials that find that direct exposure to air pollution can cause respiratory problems, especially among people with asthma. Epidemiologists have documented that high levels of air pollution are associated with a wide range of bad health outcomes, like cardiovascular disease or cancer or even dementia in some cases. And then there is my own work that I just mentioned, finding a direct causal link between exposure to air pollution and increased mortality and medical spending among older age populations. So I think there's no doubt anymore among researchers that air pollution is bad for your health. I think the trickier question is quantifying exactly how bad it is for your health. That's a very important policy question because we all want to have cleaner air, but it's also it's expensive to comply with air pollution regulations, and so there is this question of exactly how much regulation should we have. Is that worth the benefit that we receive? And to answer that question, we do need a fairly precise estimate of the health effects of air pollution. It's not enough just to say, well, it's bad for you. We need to know, well, how bad for you is it exactly, and what value should we place on that, and then we need to compare that to the cost of air pollution regulation.
Awesome. Spoken like a true economist. So as you detailed, Illinois residents should be concerned, and any residents in the U.S. should be concerned about air pollution for their health. But what are the economic consequences of high air pollution?
So I do think the primary consequences are exactly what you just said, which is that it's bad for your health. I think that's what people should be most worried about. There are some knock-on effects from that. If you're in bad health, it's more difficult to work long hours, or maybe you need to retire early. And so those are real effects. But I think they're dwarfed by the direct health effects of air pollution. Because I think it is important to emphasize, as we were just talking about, that it does cost money to comply with air pollution regulations. So the EPA estimates that those costs are on the order of tens of billions of dollars per year, right? That's the cost of sort of complying with the regulations set forth in the 1990 Clean Air Act and so on. That's not a trivial sum of money. Now, in my work, we have looked at those amounts and tried to compare them to the health benefits. And according to our calculations, there's no question that the health benefits are dramatically larger than these cost estimates. So I think these costs, this price is well worth paying. But it is a real cost, and so I think we should acknowledge that it is not a free lunch. When we tighten air regulations, when we make them more stringent, that is going to have real economic effects. And the question is, are those more than offset by the health benefits or not?
Who pays the price of the cleanup that you are mentioning?
So it depends on the particular offender. So in some cases, the costs are incurred by companies, and then in that case, it will be shared perhaps between the shareholders of the company and the people who purchase the good. Right? If we think about energy costs, if it becomes more expensive to produce energy because we had to install scrubbers or something like that. Well, energy costs are an input into many things in the economy. So the costs do tend to be quite widespread. They may be more concentrated among certain industries and among certain consumers, but I think they're borne in general by most people, at least to some extent. So.
Great. Thank you for detailing that. In your report, in your policy spotlight, you say that the Illinois EPA uses state implementation plans for counties that have outside air pollution higher than allowable limits. What type of public policy strategies have been proven to improve air pollution in the U.S.?
Yes, so the way it works in the United States, at least, is that we have a set of air pollution regulations that are determined by the Federal Environmental Protection Agency, the federal EPA. So, for example, the current standard for PM 2.5, which is fine particulate matter, sort of very tiny particles in the air, is, if I recall, 9 micrograms per cubic meter at the annual level. So this is monitored at the county level. And so if you live in a county where the average amount of fine particulate matter exceeds this threshold, the threshold of 9 micrograms per cubic meter, then you're considered to be in violation of the EPA standard. And that's when they ask you to put together this state implementation plan that you mentioned. So in that plan, you basically say, here is how we're going to fix this. We're going to install some new technology in our coal plant in the county, which we think is going to improve pollution levels, for example. If you don't improve over the course of several years, so if you continue to be in violation, then you can be subject to sanctions. So, for example, the federal government might decide to withhold highway funds from your local municipality. As far as I can tell, this has been a very effective way to enforce the federal EPA standards. So I think the real question is not so much how do we increase compliance with the requirements. The question is, should we continue to keep the current air pollution standards that we have, or should we tighten them even further?
Is there talk of lowering the threshold for fine particulate matter for counties to be complying with?
Yeah, so I think there's always talk about it. And as a matter of fact, if you look at the air pollution standards in the U.S. Over the last 30, 40, 50 years, it's been a tale of continued tightening. Right, so the standards have almost always been continually tightened over time. In my most recent work, we were estimating the effect of fine particulate matter on mortality among the old age population using data from the time period 1990 to 2013. So somewhat recent. And one of the reasons that we were interested in this topic using those data is because, of course, the air pollution levels in the 90s and later are much lower than they were in the 70s and 80s. And it's an open question as to whether or not, fluctuations in air pollution levels in these more recent years still produced negative health effects. We found that they did. As a matter of fact, that being exposed to just one day of bad air pollution was sufficient to increase mortality among individuals in our data set. And so we did a few back-of-the-envelope calculations, and according to those, the health benefits of further reductions in air pollution are still significantly greater than the estimated compliance costs that are published by the EPA. So, from my own personal best estimates, it would be beneficial to further tighten those regulatory standards. But I think this is a process that really needs continued monitoring. Right? It is important to have the most recent estimates available in terms of how much it costs, right? It's not trivial to comply with, further stringent standards. And so I think this is, again, where the research is very important. Are we still seeing health benefits from further reductions in air pollution? And are those large enough to warrant increased compliance costs? And I think my best guess is they are at the moment, that we're still in a regime where further reductions in air pollution are worthwhile.
Great. So it's an ongoing conversation, it sounds like.
Absolutely.
Yeah. In your paper, you talk about some people being more vulnerable to air pollution, especially in terms of mortality. Could you detail the types of people who are a little more vulnerable to air pollution and its detriments?
Yes. So the vulnerability is another word sort of for risk factor. There are certainly some groups who are more likely to die following exposure to air pollution than others. Probably the single largest factor is age. So older individuals died higher rates from air pollution exposure than younger individuals. In our prior work, we had information from Medicare beneficiaries, and so we had measures of things that you could see on Medicare claims. So how often were you admitted to the hospital in the last year? Do you have any chronic conditions like hypertension or a prior stroke? These kinds of things. Pretty much any measure of poor health status that you could think of, such as being admitted to the hospital more often, or at an extreme, being in hospice, were all correlated with being more vulnerable to air pollution. So I would say, just as a general rule of thumb, the worse health you're in, right, as proxied by being older, having more chronic conditions, having higher medical spending, all of these are signs that you are more vulnerable to air pollution.
Air pollution has a detrimental impact on the lives of residents, as you just detailed. How can the general public stay informed about air quality index, also known as AQI, levels in their area?
My favorite utility is just an app called IQ Air. You can download it on your phone. I think it's free, or maybe it costs $1 or $2. But it provides you with up-to-date forecasts of your local air pollution levels. So it tells you the air quality index, which is a summary measure of air pollution levels. It also breaks it down into the different types of air pollutants like fine particulate matter and sulfur dioxide. So if you're interested in seeing all little details, it has them there for you. And it also provides hour-by-hour forecasts, for during the rest of the day as well as in the days to come. So I think it's very useful for if you're somebody who suffers from asthma and are particularly sensitive to air pollution levels. I think it's a great device for monitoring how much air pollution there is in the air.
Okay, great. I know that I personally just from time to time see it in my weather app, which is nice, but it's good to know that there are other options out there. Do you have anything else you'd like to share about this topic?
I think the last thing I'll mention is just that, in my view, the large reductions that we've enjoyed in air pollution over the last 50 years really is one of the greatest public health accomplishments of our time. It is one of the reasons why we live much longer today than we used to. Life expectancy, with rare exception, has continued to go up and up over the years, and air pollution is a major reason why. And I think and to the extent that to the extent that air pollution continues to decrease over time, I think we will probably continue to enjoy many health benefits in the years to come.
Yeah, that's great news to share.
Yes, awesome. It certainly is.
Do you have any type of program or research you'd want to share with our listeners where they can learn more about what you do?
So all of my research is available on my website, julianrief.com. So I have the most current relevant research is a paper looking at the long-run effects of air pollution on survival. So, because it's so difficult to disentangle the effects of air pollution from these other factors like income and so on, researchers tend to focus on very short-run changes in air pollution. But that's not really what we care about from a policy perspective. What we really want to know is if we reduce air pollution levels by, say, 10% for the next 30 years, what is the effect of that on life expectancy? And so that's what my most current research looks at. And the short version of it is that many of the health benefits take a long time to materialize. This, again, is probably not surprising if one studies the biological mechanisms underlying the effects of air pollution. We know that it's responsible for cardiovascular disease, and it's a contributor to cancer. All those things take years, if not decades, to develop. And so when we reduce air pollution levels, yes, there is a benefit in terms of reduced mortality in the short run, but there's also very good reason to believe that the long run effect will be even larger. And so this is good news because it means that all of this reduction in air pollution that we've enjoyed over the last 10, 20, 50 years will continue to have large health benefits in the years to come.
Great. Thank you for explaining that. Listeners can go again to julianrief.com for more information about his work. Thank you for joining us for this important conversation with Professor Julian Rief. His insights remind us that environmental issues like air pollution have real health concerns. Stay tuned for more conversations that inform the policy conversation in Illinois and beyond. Until next time, thanks for listening.